Hello, warriors. Welcome back. So today I'm having a Therapeutic Plasma Exchange, which is basically, if we dumb it down, an oil change for your body. So as you can see, the blood is leaving from the left side of my arm. You can see bright red blood. I have a steel needle in. It's going up through the machine. It is being processed. So my red blood cells are going through a membrane. It is taking off all of the plasma, which you can see is the yellow, kind of orangish yellow fluid. In the plasma, we have protein. And the thing about proteins is that's where we have all the funk that gives us autoimmune disease. So in the plasma, we're getting rid of that. Like, we're taking all that plasma away from my entire fluid volume. So all of my blood will pass through this machine. I usually shoot for about 70% for every pass that we do. So what does this do? What does this take out? Spike protein. It takes out cytokines. It takes out inflammatory proteins. And then it replaces them with albumin. So how is this different than something you might get in a hospital? Because this is literally the exact same machine they use in the hospital. So somebody goes in and they have an acute case of Guillain-Barré. This is now used. It is used multiple times. Like, you can do it, 6 or 7 times throughout a hospital stay to basically take out all the bad stuff and replace it with clear albumin. Actually, in the hospital, I think they use fresh frozen plasma. We don't do that. We don't want to bring anything into the body that might have some sort of resonance and some sort of genetic material, right? So it's albumin. So people worry about that, obviously albumin and being introduced. We haven't had people have issues. Now, there is citrate. That is what we use as our anticoagulant, and that's what you have to use for therapeutic plasma exchange. People worry about citrate, especially in the mold community. Again, we do I want to say pre-medicate, but it's more like supplement you so that you don't have any kind of reaction. Now, what does a citrate reaction feel like? It almost feels like a muscular contraction, and it's usually because your calcium is dropping. After my blood is processed and all the plasma is taken out, it goes back into the return line. Now you can see I look like I've been through the war. That is because my vascular structure was difficult today. I do my vascular protocol, but unfortunately, they had to try about 8 times. We did get a return line in my foot. So it is very unlikely, unless you have horrid vascularity, that you won't be able to have a successful procedure. So the cool thing about this is we can make it happen. They didn't give up. We're never going to give up on you having the procedure. So who is this good for? This is good for anybody with a chronic autoimmune disease. This is good for anybody with an acute phase of something, right? Like if you have a long haul COVID and then you get, some sort of flare, or even just long haul COVID. It's great for Lyme. It's great for mold. It's great for environmental toxins. It's great for forever plastics. These are the one thing that can take those things out of your body and not have them returned. So we see it as an anti-aging longevity treatment in addition to obviously the aforementioned conditions. The last one I had was in January after my cavitation surgery, the same day. I usually plan to do it about once a quarter. We're a little bit behind because I have to block off my schedule. Obviously, I was supposed to start this around 10:30, and it took a little bit longer between getting vascular access, getting everything ready, and everything going. Procedure altogether, if you're amazing and you have great pressure and it's easy and we can go at full bore, if we go for 60 to 70%, ideally it's going to be less than 2 hours. We're running mine a little bit slower because my foot vein obviously is a lower pressure than my arm vein. So we've been going for probably about an hour and a half already, and I have at least an hour and a half to go. So it'll be a little bit slower. What we add on to this, at the end, I'll get fluids because we didn't want to pump fluids in at the same time, even though with most people we can. So we replace all the things we're taking out so you don't have any side effects. So it's kind of like our formula for your cocktail. I will also have stem cells because my blood is going to be super pure. We'll see how much of a warrior I am. I was planning on doing EBU after, because by the time you have the double access, it's kind of worth it to just go ahead and do EBU. You're super clean, and then whatever's left, you can hyperoxygenate with EBU. But I'll definitely have stem cells. We'll see about the EBU and adding on an extra hour to the procedure time. If this sounds interesting to you, or you have any questions about the procedure, give us a call. We've done hundreds of patients and had great results. Or you just want to come in and have an oil change because you've heard it's incredible. You've seen it on all the big influencers. They're going in for their oil changes. Reach out to us anytime. We'd love to help you. Have a beautiful day, guys.